Okay, should I stay unmuted, or you want to me to mute myself?
You can stay unmuted. It's just you, so you can talk freely. Okay, so maybe bring the camera down a little bit more so I can see your pelvis. Okay, that looks pretty good. Let me move this. Okay, so now that you're on your back, we're going to put you on your stomach.
Okay.
Yep. Okay, we're going to go into a plank position. If you have the hand out there, we're going to go into a full plank position, just like Amanda is here.
Yeah, you know, I can't hold it very long, so I either go to my knees or my forearms.
Start high plank. Okay, either one. If you want to stay on your knees, that's fine. Amanda is off of her knees,
Okay.
and this is if you read my description of the class, if you want to rest for a second, Amanda, we're going to max this out as kind of your baseline measurement, and then we'll retest this again at week 4 to see if you've improved. It could be a good marker for yourself and for us. Okay, so we're going to start in a high plank. You can be off of your knees or on your knees, wherever you feel comfortable. And from here, you're going to transition into a forearm plank, and I'm going to time this. Okay, and you're going to go back and forth. Hang on, Amanda, hang on. Okay, you ready? For 1 minute. Let's see how many you can get. So down and back up is 1, okay? And ready, set, and go. So Amanda, you're going to count for yourself, okay? That's 1. That's 2. That's 3, Allison. Very nice. Try to really keep your core solid. Allison, bring your knees further away from your arms so that your butt drops a little bit more. Good. Then you'll feel more core when you're doing your exercise.
Oh, yeah.
That's 4. Oh, yeah. And the further back you go, the more you're going to get through your abdominals. That's 5. That's 6. You guys are over halfway there. That's 7. That's 8. Try to alternate arms so it's not the same arm coming up at the same time. That's 9. That's 10. That's 11. And you're done. Take a break. Okay, so you had 11 repetitions there. Okay, so that's the max out. Okay, and then we're introducing a new stretch today. If you look at your handout, it's called a downward facing dog. So Amanda's going to be in. Yeah, it's a yoga. It's a nice yoga pose. It can be a resting pose or it can be a transitional pose. So into full high plank, Amanda. And then, yep, that's fine. And then drop your butt. There you go. So you're kind of making a triangle out of yourself with the apex of the triangle being your rear end. And what you're really thinking about doing is trying to really lengthen your spine. Good. She's got her heels down, as you can see, and her butt's up in the air. And she's really trying to establish
I can't get my heels down.
That's fine. You go as far as you can. Most people cannot get their heels down, Allison, so don't feel bad about that. And she's trying to establish a balance between her upper extremities support on the ground and her lower extremities. So a balance between all 4 extremities making contact. Her wrists are not feeling so great, so she's kind of compensating a little bit and kind of changing it up, and that's fine. And the whole point of this stretch is to not only strengthen, but also to create space in her spine, a lengthening in her spine. Okay, and take a break. You're gonna do 1 more. Are the wrists bothering you, Amanda? Yeah. Yeah. Okay. Try it again. Okay, let's see yours, Allison, when you're ready. Good. That looks pretty good. Now you're thinking about the cue that I give patients in the clinic is to try to bring your chest to your knees and your knees to your chest. So you're kind of meeting in the middle and trying to create that length. You're almost using your shoulders to create that length through your spine. Okay. And you're going to hold it a few more seconds. That looks pretty good, Allison. And good. Take a break. Hands okay on this?
Yeah, but it's exhausting.
Yeah, it is hard. People say it's a resting pose, but it's more a transitional pose for yoga. You go from a standing to, it's an easy way to transition from what we call a plank position or on your stomach position to a standing pose.
Yeah, I did yoga badly for 20 years.
Yeah. But it's a great way to exercise. I do yoga myself. I do it a lot with a lot of my patients. So it's a great way to strengthen. And you get a lot of stretching and flexibility at the same time. Okay, we're going to move on to our next exercise, which is a forearm plank. What do they call it on the handout? With a 3-way pelvic driver. So I want you to watch Amanda first, Allison. She's going to demonstrate a couple. Okay, so she's going to be in a forearm plank on or off of your knees, your choice, and then swivel your pelvis to the right, and then to the other way to the left. So she's kind of doing a half circle with her pelvis. So she's swiveling to the right and to the left. Good. And then her weight is on the outside and inside of one foot, and then on the opposite, on the inside and outside of her opposite foot. Okay. So it's a swiveling action with her pelvis, maintaining her plank position. This is number 4. Good. And then I'm going to watch you do it, Allison, and one more out.
I'm going to try, but I'm going to need some tutoring.
If you need to be on your knees, that's fine.
I'll do the knees.
So if you want to see Amanda do it on her knees, she's swiveling. She's still maintaining that nice plank on her forearm position. And then she's just swiveling the hips as far as she can to one side without letting everything go or without over rotating. And then she switches directions and back and forth 5 times each way.
How's this?
Your heels don't touch. I would move your arms away from your feet a little further, Allison. More. And now drop your butt toward the ground more. Good. Now go from there. That's going to make it harder. That's 1. That looks really good. 2, to create that swiveling or that rotational movement through your pelvis requires a lot of abdominal control there. That looks really nice. That's 3. That's 4. And 1 more. And that's 5. Drop the child pose, please. And hold. You should feel those abdominals working. The arms are, of course, going to be working because you're in a forearm plank position. But the core is what's really controlling that pelvis. So the pelvis is driving the muscles in the core to really work and activate.
Yeah, I felt it. I totally felt it in my core.
Great, great. So rest for another few seconds, and then we're going to go for another rep.
Oh, God. Okay.
Well, that's the point of these exercises, these classes, to get people moving and schwitzing, like you said. Amanda's got a fan in here because she really works.
Wait, Amanda's not schwitzing?
She's I don't know if she's schwitzing, but she's working. All right, let's set up again on your knees. Okay, good, Amanda. When you're ready, go ahead and start. So it's a swivel to one side, and then a swivel to the opposite side. Half circle. Good. That's 1.
In the middle, is that okay?
That's fine. Let the pelvis go a little further, Allison, to that left side of yours. You're kind of cutting it short. There you go. That's it. That looks good. Everything that looks really nice. Keep it under control. This is number 4. And 1 more to each side here. Right 5 and left 5. And take a break, Allison. Ten more seconds. So we're introducing more dynamic movements. When we first start doing a lot of core training with patients or anybody really, it's a lot of static. So you're holding positions like a plank for, minute, 30 seconds, whatever. Now we're introducing more dynamic things to really challenge the dynamic components of the dynamic stabilizers of your spine. All right, 1 more set, 1 more rep. Yeah, we got 3 of these. Okay, last one, 5 times at each side. 1, good. 2, 3, 4, Looks good, Allison. 4, 5, and one more. 5, and take a break. Good work. Okay, let's quickly transition onto our side plank again. Again, your choice whether you want your hip to be up or not. Amanda's going to put on a TheraBand, a red one, above her knees. And we're just going to do on the sheet, it says 2 sets of 15. That's fine. I think we can do 2 sets of 15. I think we have about 10 minutes left in the class. So again, Amanda is feeling her shoulders getting stronger because we've done this now for 3 weeks in a row. I really like this sideline plank position with combined hydrants, okay? So you can stay right there, Allison. If you want to unweight your hip, you can, but Amanda's going to go up and then go ahead and start. 1, yep, hydrants. 2, really solid through the pelvis. She looks really nice here. Nothing is moving except she's opening the knee and the foot. That's 5.
Okay. Should I go put a TheraBand on, or you think this is enough for me?
I think you probably need the TheraBand if you're keeping your hips down. I think this is probably
Okay, let
too
me try.
easy for you. Yeah,
Let's
go
see if
ahead.
I can-
Just hop in on
lift
the second set if you need to.
Well, now I'm lifted up.
Okay, if you can, as long as it's not bothering your shoulder.
Yeah,
Remember,
it's
you want to
bothering my
really,
neck.
yeah,
I
hold,
got a TheraBand right here.
yep, add the TheraBand. Amanda's almost done with the first set on this side. Good, other side, Amanda.
So the TheraBand's above my knees?
Just above your knees, yes, exactly.
So let's see. Like, so I'm going.
Oh, the foot and the knee open together, Allison. The foot and the knee open together. There you go. Good. So you really open up as high as you can because you want to really challenge that hip.
Okay, let me make it a little tighter.
Okay. So we're going to start again from the top. We got one more set on each side.
Okay. Let's try.
Good. So remember the concept of moving the knee and the foot together, Allison, so that you're not rotating through the hip. The foot and the knee open together. That's 4. How many is that, Amanda? 5, 6, 7. She's getting tired because I'm seeing some excessive movement from other areas. It's okay. You really try to find and fight the temptation to lose your form. The first set tends to be a little easier, and then you start to get tired the second and the third set. We're only going to do 2 here. Those are the ones that you really have to be disciplined. The biggest muscle that you have to overcome sometimes is your brain. Okay, but this is really working that side glute for Amanda. Okay, last one, guys, on this side. So let's see this, Allison. Go ahead and open, knee and foot open together at the same time. That looks really good. Think about if I put a drink on the side of your ribs on that left side, that drink would stay perfectly still, would not spill because there's no movement coming from there. Even though you're slightly at an angle because you're lifted up toward the ceiling, you're still so solidly pulling in with your core and your abdominals and your pelvic muscles that there's no movement occurring from your trunk. And that's where the strength comes from. Good. Amanda, you can take the TheraBand off, and then you can do your piriformis stretch to kind of reset everything. And the piriformis stretch is on your handout again. It's a very common one that we do.
I do it morning and night.
Great. It's a nice stretch for most people. They're really tight in this muscle, so we tend to do it a lot here in the clinic. I stretch people a lot, just holding it for minutes on end. So try each side for about a minute or so. And we have one more strengthening exercise after this. We're kind of going back a little bit on the next strengthening exercise. We did this early on in our first series. It was a march progression. This time we're going to do leg shootouts, or these guys are calling it core kickouts. Okay.
Okay,
Good.
my husband must not have printed the second page, so I don't have
Okay.
it on the handout.
Okay, that's okay. So
I
let's
know
see.
the march, so.
So we're gonna get your legs up in tabletop position, both of them. So remember, to get there, you wanna pull in the abdominals, okay? Pull in the belly button, okay? Hold it still. Your back flattens out just slightly, but there's still a little space, creating a neutral spine. So let's go into a double tabletop position, Amanda. Good. Now from here, once you're in a double tabletop position, shoot out, kick out one leg at a time. You don't wanna go as far as close as you can to the ground, Amanda. The lower down the leg, the more difficult. That's the longer that lever arm. Good. Really hold the abdominals in so there's no movement at all through your pelvis as you're shooting that leg out. Good. Core kickouts, as they call it on the handout. That left side doesn't want to go very far. I can see you're leaving it short. Is it cracking? Does it hurt?
Yeah.
Okay. So modify if you're feeling any pain. Amanda's feeling a little bit of pain on her left hip when she kicks it out. So we're letting her modify a little bit, but she's still getting work in on her core and her pelvis. And you're gonna do about 15 on each side, and then you're gonna take a break.
How's this? Look,
That looks really nice. Now really focus on pulling in the abdominals. Now try to straighten that knee out on the left. Straighten the knee out and pause at the bottom for just a second. 1, 2, and back. And extend the left knee. Pause. 1, 2, and back. Extend the right. Pause. 1, 2, and back. One more on each side, Al. 1, 2, and back. And last one on the right. 1, 2, and back. Take a break, Allison. Bring both feet down. Very nice. When that leg kicks out and it's about to reach the ground on your kick out, that's when you feel the abdominals really having to work. If you don't work through the abdominals, then that pelvis will release and you'll arch your back, or your pelvis will shift forward or toward the ceiling. Okay, we're gonna quickly go into our last set here of strength. Same thing, legs up in tabletop and pull in the core, keep the back nice and flat, maybe with a slight space. Good. Left, good. Right, there you go. She's got nice control on the right, but she struggles on the left, and she's having a little bit of pain on the left side. And normally what I see is that as you get stronger through your core, the problems that Amanda's having right now will get better. The cracking and the shifting that she's feeling in her pelvis and her hip will resolve. The knee. Yeah. So Amanda's got some issues on the left side, which I've seen before on some of her other exercises. She tends to compensate a lot on the left side. So in therapy, when you're here, we look for those subtle changes, subtle differences from one side to the other, because that kind of can open up the door to a lot of clues in terms of why people are having pain. Okay, that's 15 on each side. Remember to pause at the bottom. Good. And now we're going to do a spinal rotation. Amanda, I want you to shift your pelvis to either side of the mat. Cross. There you go. Go the other way. Cross the other way. And then now pull with your left hand the right knee over to your left. There, good.
oh, right knee, sorry.
Yep, and now pull that knee, Allison, toward your left or toward me, toward the camera. All the way as far as it'll go until you feel that. Yep, until you feel that spinal rotation, stretching in your lower back, stretching it in your hip. And just hold it. Good. Come back to center. Amanda, scoot to the other side of the mat. Cross your right foot over your left knee, or yep, left knee over right. Good. And then rotate over. Now Amanda's kind of draping her leg off the table. If you can see this, Allison. So if you have a bed or some kind of surface that you can let your leg drape off, it gives you even more of a stretch.
Got it.
Okay. But if you don't have that, that's okay. As long as you keep your legs crossed, you can even push with your right hand. Amanda's going to push her right thigh down toward the ground a little bit more to give her a little bit more of an overpressure stretch.
Oh, I feel this plenty.
Yep, that's all you need. Again, you do what you can. Everybody's a little bit different. Okay, good. Come back to center. That is it. You got through your first intermediate class, Allison. Well, you got with your one last week, so you did great. Okay.
Yeah, great. Okay, well, I'm going to keep up with Christina's too when I can.
Perfect.
So
Great.
that, I'm doing as many as I can.
Sounds good. And so we'll be here next week again.
Okay, yeah, I
Okay.
hope to. Once in a while, my schedule changes, but I'm trying to do them all. So
Great.
thank you so much.
No problem. If any